Hello, everybody, and thank you for joining us today. This is our community Narcan training and brought to you by Mendenoma Health Alliance in collaboration with Emily Peterson, who is a doctor of pharmacy, and she will be leading the presentation today. Just a heads up, we do record these meetings or these education workshops so that they can be available later on Mendenoma Health Alliance's YouTube page. And for anybody completing this online education workshop today, we will be providing free Narcan kits to anybody who requests it. So you can contact us after the workshop today and let us know that you completed it. We will have a log of all of the people who participated, and we can provide you with some free Narcan. Without further ado, I'm going to hand it over to Emily. And just a heads up for everybody that throughout the process of this workshop, we are going to be posting some polling questions to everyone, just to kind of gauge how everybody is understanding the topics. And at the end, we will have an opportunity for people to sign up for our newsletter mailing list. So with that said, Emily, it's over to you.
All right, thank you. So good afternoon, everybody. My name is Emily Peterson. As Micheline mentioned, I'm a pharmacist here in this community, and today I'm going to be talking about how to save a life, learning how to save a life, and the ins and outs of opioids and overdose. So the first thing you may be asking yourself is, why here, why now? And so I wanted to give you a little bit of background about myself and my practice and why this is so important to me as I'm speaking to you today. So I've been practicing in pharmacy for about 16 years. I've worked in multiple different roles throughout this time. I started as a pharmacy clerk in my early career. And, to a pharmacist working in retail and hospital pharmacy within our community. I'm fourth generation to be raised on this, northern Sonoma coastal region. And one of my greatest goals and aspirations in pursuing a career in pharmacy was really to be able to become an educator for my community and an advocate for the health of this community that is so near and dear to my heart. So the reason for the topic is, throughout my career, I've encountered many individuals. I've had hundreds of conversations about prescription opioid medications, their side effects, potential risks, if used inappropriately, and really also the important role that they play in management of pain. Prescription opioids in many cases play an essential role in the treatment of pain, sometimes acute pain, for example, after you've had surgery, and sometimes for more chronic conditions on a longer term basis. And so I've worked with individuals who have been concerned about taking opioids after surgery. They're concerned about becoming an addict or what they might experience when they stop taking them. And I've also worked with individuals who were concerned about taking opioids for pain post-surgery because of the fear, the fears associated with them. And also those who have become dependent over time, who were seeking help to now taper themselves off, or who felt like they were having physical signs of withdrawal when they stopped taking them. So those who are also seeking help. I've also experienced individuals who, opioids were somewhat of a gateway drug for them in experimenting with other illicit substances and really resulting in catastrophic, and critical health conditions that had become irreversible for individuals. So as a pharmacist in this community, I feel and I believe that I have a responsibility to try to help educate and to raise awareness about opioids, the life-saving reversal agent Naloxone, and to really focus on a total harm reduction program within our community. And, looking to break down barriers to improve access to treatment for those throughout the community. So hopefully today, I'd like to teach you a few things about opioids, about, their role in pain management, but also if you do find yourself, with an individual or come across an individual who may have overdosed on an opioid, how you can really intervene to save somebody's life with using intranasal Narcan. So our educational objectives for today are by the end of this presentation, I would like for those on the call to really understand the term stigma, defining opioid and Narcan or Naloxone, understanding the causes of an opioid overdose, recognizing the signs of an overdose, understanding how to use intranasal Narcan or Naloxone, learning critical steps in safely responding to an overdose, and also reporting reversal. This is anonymous, but it's really critically important to understanding how resources are used within our community, and also where we may have gaps in resources within our community and where to focus those efforts. So as I introduce the opioid epidemic, there's really been 3 waves in the rise of opioid overdose deaths. And you can see in wave 1, it really started around 1999. There was a rise in prescription opioid-related overdose deaths. Still on the rise, but has somewhat, plateaued over the last few years. But still a really critical issue within our communities. In the orange color there, that's really wave 2 in 2010, where we saw an increase in heroin overdose deaths. And then thirdly, in wave 3 there in the dark blue in 2013 is where we saw a huge rise in synthetic opioid overdose deaths. And synthetic opioids are, for example, tramadol and fentanyl, which are sometimes prescribed for chronic pain in the case of fentanyl, but also sometimes illicitly manufactured. And so, unfortunately, what we're seeing right now is that fentanyl is being used to counterfeit pills that look just like prescription pills, and individuals don't really know what they're getting. Fentanyl is also being put into even cocaine, so lacing cocaine with it. And so there's been a huge rise in overdoses as a result of fentanyl because it's used in so many different counterfeit and illicit products. So a little bit of information about national data. So, opioids are involved in overdoses of about 47,000 people in 2018, and 32% of those deaths involve prescription opioids. And in 2019, overdose involving opioids killed nearly 50,000 people, over 70% involved opioids. You can see that since 1999, overdose deaths involving opioids have increased 6 times. And though there was a decrease in opioid-related overdoses reported between 2017 and 2018, unfortunately, due to the impact of the COVID-19 pandemic, this has really led to an increased reports of opioid-related overdoses. And really, the numbers are yet to be seen with what that looks like. But when you look at the historical numbers, it averages out to about 40 deaths per day in overdoses, which is staggering. Also important to note that, the opioid epidemic is far-reaching. It impacts communities all around us of varying age, gender, race, education, and socioeconomic levels. It really, it doesn't leave anybody behind. Within our community, looking at some data from 2016 and 2019, Point Arena, California had the highest opioid-related overdose death rate per capita in the county and the state. And Gualala had the highest opioid-related overdose death rate per capita in the county and state in 2019. The data also suggested that Gualala was ranked second highest in opioid prescriptions per capita in the state at 982 prescriptions per 1,000 residents. And really, this per capita it's not meant to say, 9 in 10 people have a prescription for an opioid in these areas. It's on a per capita basis. So it could mean that some individuals have no prescriptions, but other individuals have, 3 or 4. So just keep that in mind. Also, interestingly, when the survey talked to middle schoolers and high schoolers, 15.3% of them reported taking a prescription medication not prescribed to them, and 87% of students surveyed reported parents or teachers seldomly or never talking to them about the dangers of substance abuse. Sadly, in Mendocino County, the rate of opioid overdose deaths is 3 times more than the rate for California as a whole. So clearly, looking at national data and then narrowing that down to our more local community data, we really have, some work to do here in getting the word out about resources and reducing the stigma and really focusing on a comprehensive harm reduction package for our community. So I wanted to talk a little bit about the term stigma, and then I'm going to show a great collection of videos that was put together by Mendenoma Health Alliance with regards to overcoming addiction and reducing stigma in our community. So when we think about stigma, it's really a mark of disgrace associated with a particular circumstance, quality, or person. And so there's really a lot of stigma around addiction, substance abuse, people who may be taking opioids. I've even had people feel offended when I talk to them about intranasal Narcan and the important role that it played in just having it on hand. There was felt to be an insinuation that I was, putting this mark of disgrace on them for taking an opioid prescription after their surgery, when really it was just a conversation about how can we keep you safe should something happen. It detracts from the character or reputation. A stigma creates labels and stereotypes, and really a negative belief or attitude towards others. Stigma also creates inequality and a division of individuals, oftentimes leading to a lack of resources or an inequality of resources throughout a population. So I have the video up already because I was hoping that it would save. So let me make sure that my screen is sharing still. I'm going to start the video.
We are in Northern California, and it is beautiful here, and we have dealt with the same thing that everyone else is dealing with: racism, health inequities. Homelessness is high, people are out of jobs, and substance abuse is really affecting our entire community.
Studies have shown that approximately 60% of addiction is genetic predisposition. So there are many triggering factors that can lead to addiction. People suffer from depression, or simply people suffer from other psychiatric disorder, put them at higher risk for addiction. Prescribed opioid medication is another gateway, and of course environment can also be a factor.
Isolation is a big part of addiction here. This community is, a lot of us are like spread out, and they use alcohol and other drugs to cope.
I became addicted to opioids after having spinal surgery, and I started taking medication as a result for the pain, and was addicted to them in total for a year and a half. I thought stopping the drugs would be easy once I decided I was going to, and I was having physical reactions that I could see and feel when I wasn't getting the drugs. So it was harder than I thought.
By the time I was 12 or 13, I was smoking meth with my mom, and I was using every day after that, and it was really hard to imagine having a day without being high. And I went through several different foster homes my last year and a half of high school, and the last home I was in were foster parents who were a little bit hippie, a little bit rock and roll, and without their unflinching love, especially in the light of my most awful behavior. I honestly think that I may have killed myself, either accidentally or otherwise. My life today is such an incredible miracle, and it is never lost on me. I'm in my 27th year of recovery, and there are still some days where I stand at my kitchen window and I look outside my backyard and I'm struck with disbelief that I live in a safe home with my sons who are safe, who have everything they need, who have never seen me loaded. My life is incredible.
Many people experiencing addiction do not seek help because they feel shame about their addiction, and they're concerned about being judged by their friends and their family or the general community. So it really, stigma surrounding addiction and it being their fault prevents them from getting the help that they need.
Oftentimes, stigma becomes a barrier. So if we want to see a successful outcome, we have to start from there. Our role here in our community is really to educate everybody more about what is addiction. We need to let people know that the earlier that we can start the intervention, the better outcome that we are going to see.
Freshman year, high school, I got caught smoking marijuana on campus by our favorite teacher, so that was pretty shameful. I got expelled from the school, so I went into depression. I got back into school, played sports, but I still drank, I still smoked, and then I think eventually I used meth. One night I overdosed, that really took me really by surprise. It really woke me up to realize that I could have lost my life, and it really helped me realize that I need to stop abusing myself. My body, my spirit was telling me that I have a bigger purpose to serve. To be able to recover here in my own community at home was the best thing, because it really opened my eyes to what the true meaning of being a community member, being a family member, being a friend, being a husband really means. The life that I live today is amazing. I'm thankful to be able to experience fatherhood, be able to experience being married for almost 12 years. My mind and my heart is open. I feel connected. Through recovery, that's possible.
If you're a loved one of somebody who's struggling with addiction, I think one of the first steps to do is reach out. Let that person know that they're loved and cared for, and let them know that you're not going to judge them for the choices they've made in their path. When someone is ready to ask for help, there are definitely resources in our area, and with Mendenoma Health Alliance, we can help you get connected to those services. It can be online, it can be in person. We're here to help.
If you're a person experiencing addiction, I want you to know that you're not alone. Mendenoma Health Alliance is more than ready to help you find the resources to jump those obstacles that are in front of you.
Addiction is not a choice, and it doesn't define people.
Como hablamos de las personas que usan drogas, importa.
I am not my addiction.
We can overcome addiction
Together.
The Instant Pot, and cooking any grains actually, is that you want to make sure that you measure. All right, I'm going to add a little liquid because I saw something sticking there, and I don't want that. So I'm just going to give it a stir. Because sometimes these Instant Pots, they'll just turn themselves off if they don't like it.
Is it still playing? Okay.
So let me look at the recipe and make sure I got everything.
That's what it is. Still getting used to this virtual meeting. Thank you. Okay. So the next topic will be to talk about opioids. They come in natural, semi-synthetic, and synthetic. And I think this is important to add context to the different types of opioids that we see and the differences between them. So to start, opiates are opium or derivatives of opium, which are naturally occurring and come from the opium poppy. And so when we think about natural opioids, those are really morphine and codeine. They are the primary active components of opium. And so when they're extracted when they're taken out of the opium poppy, those are the primary active components. Semi-synthetic opioids are created from naturally occurring opium products, such as morphine and codeine, but there is a manipulation via heating or extraction or other methods which slightly alter their chemical components and make them semi-synthetic. So our semi-synthetic are the oxycodone, hydrocodone, hydromorphone, and oxymorphone. Heroin is another example that is processed from morphine and extracted from certain poppy plants. And then you have synthetic opioids. Synthetic opioids are made in laboratories. So they're not naturally derived from the opium poppy. They are chemically manufactured to look like and are designed to act like opioids in our bodies. And so they are the fentanyl, methadone, and tramadol. And I did want to just make mention that methadone is a synthetic opioid. It is used to treat pain, but it can also be provided through opioid treatment programs to treat opioid use disorders. So it does have a few different uses. I did want to go into just kind of covering a few of the brand names, the generic names of some of these medications, and a few of the slang names that you might hear from individuals who may be using them or looking for these medications more illicitly. So fentanyl is otherwise known as Actique or Sublimase, and then you can see that there are some of the slang names there. So Tango and Crash, TNT, Dance Fever. Hydrocodone is also known as Norco or Vicodin. People may call them bananas. The Watson 387s, that usually pertains to the manufacturer of the Norco pills, the color of them, what are the numbers on them. Sometimes there's a preference for different manufacturers. Hydromorphone, otherwise known as Dilaudid. This may be referred to as juice, smack, footballs. Oxycodone comes as Oxycontin, which is the extended release version, or also Percocet, which is a combination of oxycodone and acetaminophen. But you can see a few of the different, oxys, tires, kickers, so a few of the different slang names. Morphine also comes in an immediate release formulation or an extended. And so MS Cotton is the extended release product, which works over a longer period of time, sometimes referred to morphos or monkeys, God's drug. You have methadone, although otherwise known as methadose, and you can see some of the names there. And then I also wanted to just mention heroin, since it does fall into the category of not prescription, but still an opioid that is seen out there. And black tar, black eagle, skunk, smack, snow, just a few of the slang names. The next topic is to talk a little bit more about how opioids affect their brain. Because that also plays an important role in understanding how these medications also can result in an overdose, either accidentally, unintentionally, meaning like somebody is taking a prescription opioid and they forgot that they've already taken one and they take another one, or in somebody who is not tolerant to opioids and doesn't realize that, the counterfeit pill they were using has so much fentanyl in it that it could cause an overdose. So the way that you can see the normal brain there on the left, and we have in our brain and our nervous system these opioid receptors. And the endorphins are naturally produced by our bodies, and they look similar to opioids. And they attach endorphins, which are naturally produced, they attach to those opioid receptors in the brain. And that then normally stimulates a dopamine reward system response. So our systems release dopamine, And based on that release of dopamine, that's what causes us to feel a natural form of euphoria or relaxation, being at ease, happiness. Dopamine plays a lot of important roles in our bodies. When you introduce opioids to the brain, for example, the picture on the right, opioids attach to those same opioid receptors. However, it causes an excessive stimulation of the dopamine reward system. And when used appropriately, opioids play an important role in treatment of pain. However, with some of the unintended side effects, it includes euphoria or a sensation of pleasure or happiness, so a little bit of a feeling of a high, which one often feels when taking opioids. And this is really the result of that excessive stimulation of the dopamine reward system. So over time, what can happen is that our bodies become less responsive to the doses that we had been taking. Could be for pain. And so we end up having this escalation or increase of the doses in order to have the same relief of the pain that we were experiencing, or in the case of if they're being used illicitly, the dose that you take ends up being higher in order to produce that same euphoric type feeling. And so the escalation of the doses or more frequent use of opioids is needed to produce that same feeling. And so as you look at that feeling of that dizziness or euphoria, the sensation of pleasure or happiness, that's actually a side effect, a perceived side effect of opioids. It's one of the common side effects. A few other common side effects include an upset stomach, or sometimes it can cause people to feel nauseous or throwing up. They can also cause a dry mouth or constipation. Over time, as our bodies build up a tolerance to opioids and the pain relief that was associated, the pain relief and the associated side effects that were once experienced with lower doses are now only observed with increased doses. And as you increase your doses, your risk of more serious side effects actually increases. And so some of the serious side effects are slow or shallow breathing, trouble breathing. It can cause confusion, hallucinations or vision changes, and even sometimes loss of consciousness or passing out. And so for individuals without prior use of opioids, or individuals who have an escalating use of opioids, increasing their dose, or somebody who doesn't even realize that they're using an opioid because they think that they're using, cocaine, but really within the cocaine is fentanyl, or they think that they're taking a counterfeit prescription medication, or they think they're taking a real prescription medication that they, bought from somebody, but really it has fentanyl in it. And so this increase in dose of these opioids really has an increased risk for the serious side effects, including opioid overdose. So the signs of an opioid overdose are kind of notated here, but to go over some of them, it can be that drowsiness or that difficulty staying awake. So what you see as a side effect becomes a more serious side effect, which then translates into a sign that somebody could actually be overdosing. If you are not able to arouse them, they're not able to stay awake, that could be a sign of an opioid overdose. Slow or weak or shallow breathing, or no breathing at all. If you can't wake somebody up, so if you come across somebody and you shake them a little and you can't wake them up and they're unresponsive, that can be a sign of an opioid overdose. Dizziness and confusion, or if somebody's lips and their nails are turning blue, that's really a sign of lack of oxygen and can be a sign of opioid overdose. If you do come across somebody who you think may be overdosing and you're not able to arouse them, you can give them a firm, you call it a sternal rub, so right here on their sternum, or you can, gently, kick their foot a little bit to try to get them to wake up. But if they're not waking up, not even, slightly arousable, then this would definitely be concerning. And as the carbon dioxide levels increase and oxygen levels decrease, this is really what leads to brain injury. And so, it's important to recognize the signs of an opioid overdose. It's also important to recognize that, like I spoke about, fentanyl is being added to meth, it's being added to cocaine, it's being added to counterfeit pills that are on the black market. And so even though you might not think that somebody is taking an opioid, if they are using other illicit substances, it could be quite possible that they may experience an opioid overdose. So emergency response is critical, and time and response during an opioid overdose are really the difference between life and death. And so number one is to call 911. You want to call 911 right away. There is California's AB 1535 and the 911 Good Samaritan Law, which supports not only expanded access to naloxone, but it encourages people to call for emergency assistance at the scene of an overdose without fear of being arrested or prosecuted, because really the importance of treating an overdose is so critically important to saving somebody's life. And we would rather have people, administering intranasal Narcan, calling 911 and helping to save somebody's life than be at fear of being arrested or prosecuted for being around or associated with the situation. So you want to definitely call 911. Number two is you want to administer intranasal Narcan. And so it's pictured there, and I will be showing a video shortly with regards to how to use it. But it's really, you just put it into the nostril, into the individual's nostril firmly, and you press the red plunger up with your thumb, and it sprays the intranasal Narcan into the nasal cavity, and it starts working very quickly. Lastly, you want to stay with the person. You want to put them into the recovery position where they are turned onto their side, and their hand is, supporting their head, and the knee is propped over in front of their body, which prevents them from rolling over. And this is because if somebody were to start coming out of an overdose, they could potentially vomit or throw up, and you don't want them rolling back over and, choking on that. You want to stay with the individual and monitor them. So you can give a second dose really within 3 to 5 minutes. If you are not seeing any response, the recommendation is to give a second dose. And so each of the intranasal Narcan kits comes with 2 of those intranasal sprays. And if you don't see a response, it would be appropriate to administer another dose. And I think at this point we have a poll.
Yes, thank you. I'm going to go ahead and launch our first poll and give everybody a few minutes. It's just 4 questions that are all anonymous, and we will review them when everyone's done. Looks like responses are rolling in, so we'll just give it another 30 seconds. All right. So the first question we ask is, true or false, heroin, Oxycontin, and fentanyl are all examples of opioids. 100% of people said true, which is accurate. What are the signs of a possible opioid overdose? 100% of people said nodding off, can't wake up, blue lips, and clammy skin, which is accurate. Number 3 is naloxone is known as Narcan, tramadol, morphine, or codeine, and 100% of participants got that right. It is Narcan. And the 4th one, Emily, we just may want to review really quickly. It says true or false. If you are unsure if someone has overdosed, do not administer Narcan. 27% said true.
Great. This is a really great question. So to talk a little bit more about the use of intranasal Narcan, whether or not you think somebody may be overdosing from an opioid or not, it's really critical to administer the intranasal Narcan because we don't know, and because administering intranasal Narcan to somebody who is not overdosing on an opioid is not going to hurt them. So, you know, if you are unsure, if you come across somebody who's not responsive, who appears to be having trouble breathing, or who is not arousable, maybe you look around and you see some paraphernalia, you know, a pill bottle, or that they've been using something, it is best to administer intranasal Narcan because it's not going to do any harm if they're not overdosing. Now, keep in mind, you know, if you administer intranasal Narcan and you interrupt, you know, somebody's high who may not be in a life-threatening overdose, they may not be very happy with you. However, if somebody is really overdosing, that's really the difference between life and death. And so it's always better to administer Narcan rather than to risk, you know, not administering it and somebody really is overdosing. A really great point. So what is Narcan, or naloxone nasal spray? So Narcan is the brand name of the drug naloxone, which we just covered in the poll. And it's used to rapidly reverse the effects of an overdose from opioid drugs. It is available as an injectable or an intranasal spray, and most commonly, you know, throughout the community, it's available in intranasal spray form. And just important to reiterate that naloxone really does save lives, especially when we talk about being in a rural community, a rural environment where the response time for our emergency medical services is not as prompt as if you were living in, you know, an inner city area with more resources around. And so this can really play a very critical role in saving lives within our community and allowing more time for our emergency medical service folks to respond to an overdose. So I wanted to talk a little bit about how it works. So in this depiction here, the green little squiggly opioid receptor is similar to what we saw on the previous slide where we talked about the opioid receptor in the brain. And the pink are the opioids that end up attaching or sticking onto those opioid receptors. Naloxone is that green one. And what happens is that naloxone actually comes in and it bumps the opioids off those receptors, so it pushes them out of the way, and then it also blocks the opioids from attaching. And it can block that from happening for about 30 to 90 minutes and can reverse the respiratory depression that would otherwise lead to death. It is fairly short acting, which means that a second dose may be required and is oftentimes required. And that's another reason that it's so important that after you administer the intranasal Narcan, that you call 911 and get emergency personnel on the way, is because somebody can be responsive to naloxone, and then they may actually go back into, once the naloxone wears off, or if they've taken such a large dose that it's kind of overcoming the effects of the of the Narcan or the Naloxone, that they will require a second dose, and oftentimes several doses until the opioid is cleared sufficiently from their bodies. So I think we have another poll coming up at this point. So I'll take a pause.
Thank you. Thank you for that. All right, so everybody should be receiving the second poll. And there are 3 questions, true or false. And responses are starting to roll in, so we'll give it a few more seconds. Just a heads up, I do see that there's a hand raised. If it's possible to enter your question into the chat box, that would be great. Otherwise, we are holding questions that Emily will answer till the end of the workshop. Okay, so let's see here. I'm going to share the results with everybody. The first question, true or false: if the individual is revived using Narcan, you should stay with the individual until help arrives. 100% said true. That is absolutely accurate. True or false: Narcan can be used to reverse a benzodiazepine overdose. We had 27% say true. Emily, can you address that one?
Yeah, absolutely. So Narcan or Naloxone is very specific to opioids. So if somebody is overdosing on a benzodiazepine, the Naloxone will not work to reverse that type of an overdose. So it's only used for opioids. There's a different reversal called flumazenil that's used for benzodiazepine overdose.
Thank you. And then the last one, 100% of participants got correct. Substance use disorder is a preventable, treatable chronic illness, which is very true. And one of the things we try to stress in our work with the community is that addiction truly is a chronic illness. And if you have an opportunity to learn more about how addiction develops in the brain, you can gain a greater understanding of why it's a chronic illness. Thank you.
So this here is a depiction of how to use intranasal Narcan or how to administer it. And I am going to show a brief video, which I think helps to add a lot of context to what that looks like. I highly encourage everybody to review how to use intranasal Narcan. So look at the packaging, watch a video, learn what it looks like to use it, because when you get to the point of needing to use it, it can be really stressful trying to fumble through the packaging and learn how to use it in the moment. So I definitely recommend taking a look at the information. But it comes in a little pack, and so you just peel open the package and you'll take out the small device that I showed in the previous picture. You'll hold it with your thumb on the bottom of the red plunger, and then you'll place it, the tip of the nozzle, into the person's nose. And then you will just depress that red plunger so that the dose gets sprayed up into the person's nose. So I'll go ahead and open this video.
Hi, I'm Allison, a pharmacist, and today I'd like to go over how to use your Naloxone product. It can be really difficult in an emergency situation to remember everything that you may have learned about Naloxone. So feel free to come back to this video from time to time to review the information here so that you can always be prepared in the event that you witness an opioid overdose. So, you've called 911 and grabbed your Naloxone. Now what? This is Narcan nasal spray. It comes in a box with 2 doses. You're going to take 1 dose out of the box, remove it from the packaging, and the applicator goes in 1 nostril, and you're going to depress the plunger with a quick, firm push. When putting in the applicator, you'll want to form a tight seal at the patient's nose so that the medication goes up into the sinuses and does not come down the face. And then with a quick, firm push, you're going to administer the medication. There's no need to depress the other nostril. You can leave it open. And if a second dose is needed, you will apply it in the other nostril than the one that the first dose was given in. And that's how you use the Narcan nasal spray.
So important again, so once you've administered the intranasal Narcan, you want to put the individual into the recovery position and stay with them. If you're not seeing any response to the first dose of intranasal Narcan within 3 minutes to 5 minutes, you can administer that second dose. And always remember to call 911 so that you can get help on the way. So as we close out this presentation, I just wanted to circle back to the why here and why now question, and really just emphasize the importance of harm reduction throughout our community and the importance that education plays, understanding, breaking down barriers within our community, and realizing that opioids are abundant in our communities, that there are people who need help and support, and that there are resources that we can provide throughout our community. It's important that we eliminate the stigma associated with opioids and naloxone. So some, would say, and that's part of the stigma, is that, well, naloxone is just giving people, an out or an excuse of why they can use it or be at risk. But really, naloxone is a life-saving drug that is important for all of us to understand the role that it plays in saving lives and reducing harm within our community, so that we can work towards a healthier community and advocate for the resources that are needed and get people connected with the resources. And the importance of recognizing the signs of opioid overdose quickly and taking action to help somebody that's in need. Making sure to request emergency assistance and administer the intranasal Narcan. Remember, call 911, administer intranasal Narcan, place the person into the recovery position, stay with them, don't leave them, and administer that second dose within 3 to 5 minutes if you're not seeing a response initially. And then, educating those around you. So, it's important that we practice what we learn and that we act as advocates within our community and teach others what that looks like. And with that, I strongly believe that together we will save lives. And so I just wanted to recap on a few of the items that we went over. So what are some examples of opioids? We have the morphine, codeine, hydromorphone, oxycodone, hydrocodone, methadone, codeine, and fentanyl. And remember that naloxone only reverses opioids. It does not reverse the effects of a benzodiazepine overdose. Redefining the term stigma. So recalling that it's a mark of disgrace associated with a particular circumstance, quality, or person. It detracts from the character or reputation, and it creates labels and stereotypes that foster a negative belief or attitude towards other and create inequality. So a reminder, naloxone isn't giving people an out, and really people can accidentally overdose. If they forgot that they already took their medication and, they're still having pain, so they take another dose and they've never taken that medication, somebody can very easily accidentally overdose, thinking that they're taking their medication that was prescribed to them correctly. So it's important that we talk about it and that we understand that intranasal Narcan is a means of keeping people within our community safe. What are the signs of opioid overdose? So recall it's dizziness, confusion, somebody that's, is very drowsy, has a difficult time staying awake. They can't be woken up, even with that sternal rub or a little kick of the foot. They're choking or making gurgling or snoring sounds, or their lips are turning blue and their nails. And how to respond to an opioid overdose. So remember that time and response are the difference between life and death. So you want to call 911, administer the intranasal Narcan, and stay with the person. Put them in recovery and stay with the person, and be ready to administer that second dose if there's no response within 3 to 5 minutes. We covered the steps to administer intranasal Narcan, which again, I highly recommend that everybody review that the information guide that comes with intranasal Narcan, so you can be ready and feel confident in administering it should the need arise. And then lastly, why is it important to anonymously report the use of naloxone? So by reporting the use of naloxone, it helps to identify what communities may need resources and support. It helps to track if naloxone that is being distributed within our community is actually being used. And it may help with funding additional services in our communities, including emergency response. And there is one final poll before we open it up to questions.
Thank you. Okay, and this poll is specifically relating to how effective this workshop was for you. And again, it's anonymous, so no worrying about knowing who, us knowing who responded. So be as honest as possible. And while everybody is doing that, I just want to give a heads up that Mendenoma Health Alliance does collect data on community reversals with naloxone and Narcan, and it can be done anonymous. We just request that people who get Narcan kits from us that end up using them call and let us know very basic, unidentifiable information like the town that the overdose reversal happened in, whether it was a male or female, the general age, like 20s or 30s or 40s, and then how many naloxone doses were used. And over time, that helps us understand how effective our trainings are, how we're impacting the opioid epidemic directly in our community. And then also we have to report to the Department of Healthcare Services and a program called Direct Relief, which provide us with free Narcan. But we have to report back to them how it's being used in the community. So it helps ensure that we can get continued resources for free. All right, so I'm going to go ahead and end the poll. And the last thing we'll do is, if anybody is interested in getting important updates from Mendenoma Health Alliance, receiving our quarterly newsletter, and just being up to date with what we're up to in the community, I would love to have your email address. I'm putting a link in the chat box that leads to just a quick 2-question form that asks for your name and your email address. And if you are interested, you could fill that out and we'll add you to our newsletter. One of the great things about our newsletter is it not only lets people know about our upcoming events, many of which are educational related to health, and also our free resources that we provide in our office, but it also provides a lot of really great data on our local community. Mendenoma Health Alliance kind of prides itself on being the hub for data of the Mendenoma community. And over the last 4 years, we've been trying our best to collect as much as possible for a variety of reasons, just so we can understand at a population health level what our community is experiencing and its health needs. So the newsletters provide a lot of great information on that too. So as far as questions go, somebody says, can anyone buy Narcan locally? And so I know that in our community, you used to be able to get Narcan from the pharmacy, but our pharmacy recently closed. And so our community, I'm referencing Irish Beach, through Wallala in Mendocino County, and the Sea Ranch through Timber Cove area in Sonoma County. That was usually provided with a copay through your insurance, which was still really expensive, but Mendenoma Health Alliance provides it for free for anybody who's taken this course. And then we also collaborate with other organizations throughout the county to ensure we all have resources spreading distributed evenly. So there are places like Public Health in Mendocino County, McCaven, which is located in Ukiah, and a variety of other locations that provide Narcan for free. And you're always welcome to communicate with Mendenoma Health Alliance, and we'll provide you with some Narcan. Somebody asked, does Narcan have a shorter shelf life if stored in a warm place such as a car? So it's really important to pay attention to the expiration date and the temperature requirements to make sure that the Narcan remains effective. And so you should just ensure that your Narcan is stored in a place that is within the temperature regulations on the side of the box. And then as far as the shelf life, typically it's about a year from the time that we receive our shipment, that an expiration date is indicated on the box. But the FDA recently approved an extension for 12 months of that original expiration date because they found that the Narcan was still effective after 12 months. So you can still keep it. And I believe that there's been like an adjustment in the expiration date stamped on the box since that approval was released.
Yeah, oftentimes the FDA will do, they have to have specific studies on how long the active components of a medication are good for. And then as it's been out on the market for a longer period, they'll often do additional testing to see if the shelf life is longer than what they initially gave it. And so that would be an example of what's happened in this case. And so they're able to give it a longer expiration dating. And then on new products of this Narcan intranasal that are manufactured, they will have a longer expiration date stated on them.
Okay, and then we have a couple questions about Narcan and its effectiveness. So the next one is it better to give someone possibly expired Narcan than no Narcan at all?
Yeah, it's a really great question. So, in taking kind of my pharmacist hat on and off a little bit, when you think about if that's the only Narcan that I have, on hand, and maybe the expiration date is a month past, the likelihood that it's going to do harm to somebody is very small. However, it's not a recommendation that we can flat out make because the FDA doesn't label it in such a way. However, if you think about the risk of not administering Narcan and somebody dying of an overdose in comparison to administering, an intranasal Narcan that may be a month past its expiration date, I would advocate for administering the intranasal Narcan because it's unlikely that it's going to actually do harm to somebody. So it's a little bit of a tricky question to answer, but in thinking through it from the perspective of trying to save a life, I think it would be better to administer it.
One of the next questions I think I can help address, it says, it doesn't sound as if Mendo is experiencing a Narcan shortage. Is that correct? And I just want to say that at the federal level, where it's being distributed through programs like Direct Relief and through the Department of Healthcare Services, there is a shortage across the country being experienced. And mainly that's because such a promotion of harm reduction throughout the country. And also when COVID happened, many manufacturers started shifting their supply chains to producing COVID related materials for the community, or, vaccinations, things like that. So at a higher level, yes, there is a shortage. We have experienced it in our community. At a lower level, our organization has been able to still get as much Narcan as we need to share with our EMS agency, who's helping provide Narcan training as well. That's Coast Life Support and their ambulance service here. So we've been working with them to distribute, and then we've actually been able to access more through our programs with Direct Relief and the Department of Healthcare Services. So we've helped distribute it further beyond our service area, countywide, for other organizations that are experiencing shortages. So yes and no. In our direct service area, no, we're still doing okay, but we're not sure if it's going to hit, the supply chain choke is going to hit us or not. Okay, so let me see. Next question was, how should Narcan be stored?
So you want to store Narcan as close as possible to what you would, what a normal room temperature environment would be. Based on the manufacturing labeling, it's 68 to 77 degrees Fahrenheit. So if you think about a comfortable room temperature, you don't want to be placing it in, like a car can have very extreme fluctuations in temperature. There is some labeling with regards to, minor changes or fluctuations outside of that normal room temperature range, which would be appropriate. But you certainly don't want to keep it in a place that gets really, really hot or really, really cold. You wouldn't want to store it in the refrigerator. It's best to just keep it at normal room temperature.
Thank you. The next question is, how can you acquire Narcan? And I will say, for anybody on this call today, if you just send me a direct message with your email address, I will make sure my staff follows up with you and gets you the Narcan that you need for your household or your car. And we're also willing to, if you work in a school or there's other settings where you think it might be helpful to have some Narcan, then we will coordinate with you. So go ahead and send me a direct message with your name and your email address, and we can follow up after this presentation. And then the other part of that question is it safe to give to somebody uses without them having training? So I think what they're asking is, if somebody's actively using opioids, is it safe to give them Narcan even though they haven't participated in this training?
Yeah, so, we have the whole goal of having intranasal Narcan out in our community is to save lives. And so, yes, the recommendation is that there be consultation and education with anybody that is going to be having, intranasal Narcan for use. However, my last slide also talked about the importance of all of us, taking what we learn and really acting as educators for our communities. And there may be people who were not able to, get them connected directly to a resource and train them about the intranasal Narcan. But if you can connect with that individual and show them, how to use it safely and appropriately, I would advocate for, teaching others what you've learned and making it available as much as possible for people to have.
Yeah, and then the other thing I'll add to that is there are instructions in a tiny little pamphlet that's inside the box. And so so there is like a short, brief description of how to use it. And I believe there's some images similar to what Emily showed you today of how to administer it. And ultimately, like worst case scenario, someone knows absolutely nothing about Narcan except that you put it in their nose and press the plunger. That's better than nothing at all. So. All All right. Somebody asked me to put my organization's email address in the chat box just so you can contact us directly. So I'm doing that right now. And make sure if you do that and it's about the Narcan, receiving Narcan kits, then just in the subject line, put Narcan and we'll know exactly what you're emailing us for. All right, so let's see. Somebody did ask, I think it's the last question, is there an age limit on Narcan? For example, if a minor experiencing an overdose, can you give them Narcan?
Yes, you can give them Narcan. So there's not, especially if there's, a minor adolescent experiencing an overdose, you can administer the intranasal Narcan. There's not a different dosage. There's no way to measure the dose of intranasal Narcan that you're giving somebody. But if they are a minor, young adult, adolescent, teenager, you can absolutely use the same intranasal Narcan.
Thank you. And I just want to reiterate too that Narcan is not harmful. So if you come into contact with somebody and they're unconscious and you can't tell based off of their surroundings if there's any like paraphernalia or if they've actually overdosed. If it's somebody who's in like a diabetic coma, for example, but they're exhibiting all of the symptoms of an overdose, which is possible, then you can still give them Narcan and it will not hurt them. It will not harm them in any way. It's only effective for opioids. So. All right, so I don't see any other questions in the chat box. I want to thank everybody here for attending today's workshop. We really appreciate your interest in making our community more safe and destigmatizing addiction. And please follow up with Mendenoma Health Alliance on our YouTube page or our Facebook page by searching Mendenoma Health Alliance. And I want to say thank you so much to Emily, who has been helping us put this workshop on for, I think, the last almost 6-7 months now, periodically, and doing it on your spare time, which I know is hard to find. So everybody have a wonderful evening.